Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. How are you?
I'm living it up, as always.
Well, that's excellent, and we want our listeners to live it up. And this show is about chronic pain. It's about chronic musculoskeletal pain. That means joint pain, tendon pain, disc pain, ligament pain, back pain, neck pain, knee pain, hip pain, arthritis pain, any kind of stiff joints or dull aches that you may be experiencing, basically orthopedics. And when you call the program today at 866-870-5752 right here in the studio, you will get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has over 250 scientific studies, actually. And we want you to realize that 30 to 40% of Americans are suffering chronic orthopedic pain. So you're not alone. So when you call the program today, not only are you able to talk directly to Dr. Darrow about your story, but you're helping other people who may have similar problems to yours. So that number again is 866-870-5752. And you might want to check out Dr. Darrow's website if you're new to the program. That is www.lastemcells.com. That's www.lastemcells.com. You can email him off of every page on the site and watch him performing the treatments on videos. If you're listening for a long time and you want to call the office and make your appointment or get very personalized information, that number is 800-300-9300. That's 800-300-9300. And we want to have your calls today. The hour goes quickly, so call early in the show. Our call-in number here at the station, again, is 866-870-5752. We're here Saturdays at 10 a.m., again at 1 p.m. And again, I really want you to read this book. It's really a challenge when you haven't heard of this treatment before, regenerative treatments. So please do call and you'll get your free copy of the book. What do you think?
I think it's a great idea. I love this book. It took me years to put it together, to get the research, because doctors always want to see the research. It's strange. I'm not a big believer in research, although we do it at our office. We've got 25 people who are postgrads or in school trying to get into medical school that come to the office from time to time to do these studies that we're working on with regenerative medicine, showing what the results are using stem cells or platelets or both. And the results have been really great. It doesn't work on everybody. I always give a little disclaimer, because people, when they hear about stem cells, think it's the holy grail, and it serves its purpose, but there's no magic in this world. Or is there, Anita? Maybe there is.
Not that I've discovered.
My point is, it's a lot easier to get a surgery. Is it? No. It's a lot easier to get an injection. So all the people that get surgeries, for the most part, for orthopedics, don't really need it. And we've proved that, because a lot of people that come to us already been to an orthopedic surgeon or neurosurgeon saying they need to get surgery to fix the pain in their neck or their back or their elbow or their wrist or their knees or their shoulders, their hips, whatever. And we seem to heal them up just using cells from their own body. And it's an easy thing. You walk in the office, you get injected, and you walk out. There's not a lot of side effects. People get stiff afterwards. And for those of you that are new to the show, I have injected my own body many, 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 many times. I have a lot of sports injuries, and I stay very active. I am 72, but I like to do sports like I'm 16. So when people say, "How old are you?" I go, "I'm 16." And I want to always be that age because it's a state of mind. And I have that state of mind. I was always born young, and I was always looking for the fountain of youth. I always thought of myself as Ponce de Leon. And I'm still looking for it. You remember him, Nita.
Of course. We learned about him in 5th and 6th grade. Absolutely.
That's right. That's right. And I always thought, even as a kid, I was always thinking of being a doctor, even back to that age. But I was always like, I think people can live older. And I've always looked for the way to do it. And I've worked in many fields of medicine to regenerate the body. And some of that is with supplements. I like to do it naturally, supplements. And obviously the work I do in regenerative medicine is amazing on the physical body, of using hormone supplementation so that we stay young. And a lot of people are doing that today. You can look up hormone replacement therapy, and it's, I think, a good idea to once you're starting to get older, and that's different for everybody. Some people get older when they're younger and need hormones. So testosterone, and for women, progesterone also, and estrogen. But that's just my opinion. I've got a pamphlet that I'll be glad to send you if you want to call into the office that I wrote about it. It's called Age Management Medicine. And if you want to call the office anytime, that number is 800-300-9300 in case we don't cover what your questions are on the show. And if you want to call me right now, I'd love to talk to you. My number here at the studio is 866-870-5752. That's 866-870-5752. Please call me now. Don't be shy. I would love to start a dialogue with you. And I'm looking at the call screeners board. There are no callers yet, so I'm going to go to a question. I get tons of emails all day and all night. And if you go to my website, you can email me. The website is www.lastemcells.com. That's www.lastemcells.com. And every page on my website has a spot to email me. So I get continual emails, and in between patients I run into my computer and answer them, and I do them really all the way till late at night because I love talking to people and getting the dialogue going. Nita, I hear you breathing. Do you need to say something?
I love what you were saying about aging, because the thing that happens with people in chronic musculoskeletal pain is their quality of life is compromised. And that has all kinds of psychological aspects to it as well, because you can't go do what you want to do. And so it's so critically important what you're talking about. And we've been doing this show a long time. You've been on the air over 20 years. I've been with you. I think we're entering year 12. And it's amazing because I've had this treatment with you 2 times. And the first time that I saw you 16 years ago, I had been in pain for over a year, maybe a year and a half. And it makes a huge difference to be pain-free and be able to do what you want to do in life. I can't stress that enough.
I remember you healed up very quickly. You're a good patient. Thank you.
Because I listen to you. I don't cheat on you.
The cheating, by the way, that Nita's referring to is I always tell patients to rest the area we inject. So people don't like to rest anything, and they certainly don't like to listen to me. So I call that cheating on me. And then they come back after treatment and go, they didn't get better. And I said, because you cheated on me. And everybody laughs. They go, yeah, I did. So, this is not a panacea for every single thing in the world. Doing stem cells and platelets works when the patient's chosen appropriately and when the patient follows the doctor's directions. And sometimes they need several treatments to get better. So I'm going to go to a great email that came in, and it says, I'm on my 4th surgery and I can't take the pain anymore. But what does that mean? It obviously means that the person's 4 surgeries didn't help them. And so I wrote the person, and they sent me back this kind of lengthy email, but I want to read it real quick because I think it tells us how surgery works, like not in most of these orthopedic cases. And I know the surgeons will get mad at me for saying that, but it's just my experience. I love you guys. I love you surgeons. It's not against you. It's just that most of these surgeries should not be done. There's studies on knees with meniscal tears showing that a fake surgery, that's one where you don't go actually into the joint, works just as good as a real one. So why do it? Anyway, this person responds, hello there. Thank you for the response. My issue started 11 years ago when I was in my early 30s. I was an athletic person. I was a quarterback and a pitcher in high school. I used to be able to throw a football 60 yards. Ended up working for United Airlines as a baggage handler for quite some time. Injured my shoulder pulling a heavy bag out of a tightly stacked airplane. Immediately felt uncomfortable, went to a doctor. He did some imaging, said it was a slap tear in my shoulder. So a slap tear is a superior labral tear. Labrum is the lip around the humerus bone in the joint that helps hold the shoulder into place. And hips have labral tears too. So I get people with labral tears all the time, and we still get them better. They didn't get surgery, so don't go jump to the surgeon just because you have a labral tear or a slap tear or whatever. Person goes on to say, I agreed to have the surgery and immediately had issues with movement. Well, yeah, the doctor said it was a frozen shoulder. So that happened to me too. I had a surgery when I was in medical school on my right shoulder because I was very enamored with surgery. I was doing orthopedic surgery, and my boss said he would fix it for me, and my shoulder blew up like a frickin' balloon, and I had a high fever, and it took me several years to get that shoulder healed, and guess how I did it? By injecting it with regenerative medicine myself. I did it at night, woke up the next morning completely pain-free and full range of motion. So that's how I learned that this stuff is really good. The person then went on to say, the doctor said there was nothing he could do but wait and see. He also released me back to light duty at the airport 3 weeks after my surgery. Too bad. I complained to the doctor. He said I would be fine. I eventually hurt my left shoulder from all the overcompensating, so he said I needed surgery on that. And well, he did that surgery and said I couldn't find anything more. Well, because he wasn't looking at the right things. We finally went to a well-known surgeon downtown. He said I needed a Weaver surgery done. He opened me up and decided that it wasn't damaged like he thought, so he didn't complete the surgery. Now, that's very common. I hear of patients that come in, they have a surgery, and then the surgeon said there was really nothing wrong, so they just suture the person back up. I still had the pain in both surgeries, but you can imagine I was done with surgery. I was so upset that I went back to school, became an engineer. That's a good thing. Absolutely love my trade. Happy I completed the move. Ended up finding a pain doctor who treated my left shoulder with trigger point injections with help somewhat. But he said the other doctors didn't do me any favors. Early this year, I was feeling good, started working out with my arms for the first time in years, did elevated push-ups, and my arms were burning the next day. I went to another orthopedic. He did imaging, said my biceps tendon was torn and the other issues would require arthroscopic surgery. Oh, my God.
Wow.
Oh, my goodness. So this poor patient, I'm 8 weeks out of surgery and in constant pain. The only time it's bearable if I do nothing. I'm scared and desperate for some help. When I try to talk to the doctor, they immediately talk over me and get me out of there as quick as they can. I hope that stem cells and platelets can help me. Can you help me, please? Probably. I'd have to examine you and see what's going on. You know how I examine people? I touch them. I find out with my fingers what's going on and find where the pain generator is. So most of my patients that come in after a surgery that's failed, I ask, what did the doctor do? How did he know where the problem was? Why did he do the surgery? And they said, well, they put an MRI up and showed me where the pain was. I say, did they touch you? No. and they did a surgery based on an MRI, that's kind of not smart to me. And look, I'm just one guy. Don't kill me because I'm saying these things. It's just been my experience that a lot of these failed surgeries are because they're done on an MRI. I don't think operations should be done on MRI. If you need to operate, it better be on the person. I don't treat the MRI. I treat the person. So, want to call in, talk about these things? We're starting to get some calls. If you want to call the studio right now, you can talk to me. I would love to talk to you. My phone number here at the studio is 866-870-5752. I'll repeat it while you scramble for your pen and pencil. It's 866-870-5752. I'm going to go to another question here, Anita, before the callers rack up, if you don't mind.
Go for it.
Yeah, thank you. This one says hip. Let's see what they have to say. Hi, I have severe right hip degeneration with superior joint space loss. Can you tell me if PRP or stem cells would be of benefit to me? Or is the joint past the point of repair? My other hip is moderate to severe degeneration. I'm a 57-year-old woman who up until recently enjoyed a very active lifestyle. So, unfortunately, I can't tell you over the radio what's going to work or not work and whether you're a candidate or not. I've got to do an examination with my hands, move you around, touch the area, and see. But I can tell you this. When people come in, new patients come in, and they have these syndromes, and they show me the MRIs, in most cases, we can still help them. I cannot remember, I know I've done this, but I can't remember when because it's been so long, sent a patient to have surgery.
Yeah.
I was waiting for that, Nita.
Yeah, well, because this is a treatment that is, I mean, I want to say it's miraculous because it was.
Well,
with
we don't
me.
want to go. We don't want to go overboard and give false hopes to people. I never promise a patient anything.
That's true.
Because we never know how a person's going to react to anything. There's many patients I've had that just have like a simple tendonitis or something like that, or a sprain, and I work on them. They don't seem to get better. And then there's people that have these really severe joint degenerations that get better with one treatment, and I never understand how it works. Is it karma? You tell me, Nita. That's right up your alley.
Well, you know, I just think that in the modern world that we have today, with all the technology and all the information coming at us, it's when a new paradigm comes along, it takes a minute for people to really be open and think about, well, should I look into this? And I just want to say, you know, it never hurts to investigate something. And it never hurts to delay surgery, unless it's an emergency, of course, to look at other options, does it?
Well, you know, it's hard for humans to adapt to change, and it's
True.
unfortunate. Lucky for me, I think, I look for change, and I like to be ahead of the curve. I'm going to go to another question here. And
should
I'm
I give
the
phone number first? Yeah.
I was just going to do it. Yeah,
Go
the
ahead.
phone number to call us right now and talk to us at the studio is 866-870-5752. 866-870-5752. If you don't want to call the show, if you're shy, call anyway. You don't have to use your real name. If you want to talk to me at the office or get more information, my office number is 800-300-9300. I'll repeat it for you, 800-300-9300. And for those of you that want to just ask your questions by way of my website, you can go there. It's www.lastemcells.com. There's a spot on every page to email me, and you can ask your questions that way also. So this next question is, hi, Dr. Darrow, looking to see you and your help. I'm suffering with bilateral knee arthritis and hip arthritis as well. I'd like to know if you're able to accept my insurance. I'm 52 years old, female, in so much pain constantly. I'm still physically active and working. My last choice would be surgery. Yes, surgery is the last choice generally, unless you have something like a broken leg or a trauma that's absolutely terrible and disrupting the bones. Even things like ACL ruptures I can heal, meniscal tears, rotator cuff tears. I think personally I do a better job with torn ACLs, that's the anterior cruciate ligament, than the surgeons do, because I don't have to use a knife and cut it open and have a 9-month recovery. If a knee is really, really loose, then I would send that person to a surgery. But the studies show that if you have an ACL disruption, you're better off waiting 3 months for the knee to heal. And then if you still have a loose knee, then maybe get a repair. What I do when someone comes in with a fresh ACL rupture is I look with the ultrasound, I see where the blood is, I aspirate every drop of it out so it can heal up quickly. If you do not do that, you're going to have a giant blood clot in there. After ACL ruptures, there's a lot of bleeding inside the knee, and if you let it just sit, it's going to clot up, and then the knee is very difficult to heal. It becomes contracted, and then the surgery is more difficult. And I don't know why the orthopedic surgeons don't do that immediately. Most of them do not use an ultrasound to look inside. And so most guys today that I teach at UCLA are already learning in their residency, are already learning ultrasound. Unfortunately, the older doctors don't want to go buy one and learn how to use it, but the newer doctors are being trained in it. If you're ever getting a knee injection, a hip injection, a shoulder injection, it has to be done under ultrasound. You can't see that joint otherwise. The studies show that when a doctor injects blindly into those joints, hips, shoulders, knees, they are missing the joint 1/3 of the time. And certainly aspirating fluid out, you can't do a great job blindly, and it hurts like heck. It doesn't hurt when you use the ultrasound and numb it up. And you don't have to go near the cartilage to scrape it with that needle. So please, docs, go get yourself an ultrasound and get up to date. If you're going to be poking people, watch where that needle is going. So
that's a point.
Yeah.
Did you get my
the
joke?
Knee arthritis. Yes,
Needle,
the point.
point.
Thank you.
Thank you.
So knee arthritis we treat every day. Hip arthritis we treat almost every day. These things just are not really what we think they are, and very often the pain is not coming from the arthritis. To give you an example, as we say as lawyers, to wit, meaning the example is, people come in with low back pain almost every day. We treat it almost every day, probably every day a few times. And their MRIs, their x-rays show arthritis. But that's not the pain generator. The pain generator in the low back or anywhere in the back and neck is generally the ligaments. Okay? So many times people come in with neck or back pain and they say, well, my doctor says no surgery will help me. Okay? And I say, well, what did they say will help you? And they say they don't know how to help me. And that's where regenerative medicine comes in. Because what we do is we heal all of these areas that are soft tissue. And that's where most of people's pain in the body comes from, is the soft tissue. Not from the bones. It comes from the cartilage, the ligaments, the tendons, things of that nature. So most of the pain that you guys listening have had in your body has been in those areas in the soft tissue. So let's say someone fractures, time for a break. I'll be waiting for your calls at the end of the break. Please call us at 866-870-5752.
That's right. You're listening to Living Pain Free with Dr. Marc Darrow. Grab a pen, write this information down. I'm your host, Nita Valens. We'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.